Question 1. The assessment process reveals that a critical control point, CCP, for temperature control during the cooling of a prepared food item has been consistently breached over the past week, with temperatures exceeding the safe limit for extended periods. The food service manager is concerned about the cost of additional refrigeration equipment and potential staff overtime required to address the issue promptly. What is the most appropriate and ethically sound course of action for the food service manager to take? Option A. Document the temperature deviations in the monitoring logs and wait for the next scheduled internal audit to address the issue, as the cost of immediate corrective action is prohibitive. Option B. Reclassify the identified temperature excursions as minor deviations that do not pose a significant risk to public health, thereby avoiding the need for immediate corrective actions. Option C. Temporarily adjust the critical limit for the cooling CCP to accommodate the current operational limitations, pending a future review of the hack plan. Option D. Immediately implement the corrective action plan outlined in the hack plan for this specific CCP, which includes retraining staff on proper cooling procedures and investigating the root cause of the temperature excursions. The correct answer is D. Immediately implement the corrective action plan outlined in the hack plan for this specific CCP, which includes retraining staff on proper cooling procedures and investigating the root cause of the temperature excursions. Explanation. The assessment process reveals a common ethical dilemma in food safety management, balancing the immediate financial pressures of a food service operation with the non-negotiable requirements of public health and regulatory compliance. The challenge lies in the potential for a food service manager to feel pressured to overlook or minimize an identified hazard to avoid costly corrective actions or operational downtime. This scenario demands a professional who prioritizes consumer safety and adheres strictly to established food safety protocols, even when faced with economic disincentives. The correct approach represents best professional practice because it directly addresses a critical control point, CCP, identified through a thorough hazard analysis. By implementing a corrective action plan that includes retraining staff and revising the CCP monitoring procedure, the manager is proactively mitigating the risk of a foodborne illness outbreak. This aligns with the fundamental principles of HACC, which mandate that identified hazards at CCPs must be controlled to prevent or eliminate them. Furthermore, this approach demonstrates a commitment to continuous improvement and a robust food safety management system, which are often implicitly or explicitly required by food safety regulations and professional ethical standards for CFCS professionals. An incorrect approach that involves simply documenting the deviation without immediate corrective action fails to control the identified hazard. This is a direct violation of HACC principles, as a deviation at a CCP necessitates immediate corrective action to ensure the safety of the food product. Ethically, it represents a dereliction of duty to protect public health. Another incorrect approach, which involves delaying corrective action until the next scheduled audit, is equally problematic. Audits are for verification and assessment, not for addressing immediate safety concerns. Waiting for an audit to address a deviation at a CCP allows an unsafe condition to persist, increasing the risk to consumers and potentially leading to regulatory penalties and reputational damage. Finally, an approach that involves reclassifying the identified deviation as a non-critical issue to avoid implementing corrective actions is a severe ethical and regulatory failure. This demonstrates a deliberate attempt to circumvent food safety protocols and prioritize operational convenience over consumer well-being, which is fundamentally contrary to the role of a CFCS professional in nutrition focus. Professional decision-making in such situations requires a clear understanding of the HACC plan and its implications. Professionals should be trained to recognize deviations at CCPs as immediate threats to food safety. The decision-making process should involve 1. Immediate identification of the deviation and its impact on the CCP. 2. Prompt implementation of the predefined corrective action plan for that CCP. 3. Thorough documentation of the deviation, corrective action, and any retraining or procedural changes. And 4. Verification that the corrective action has effectively controlled the hazard. This systematic approach ensures that food safety is maintained at all times, regardless of operational pressures. Question 2. The control framework reveals that a community health educator is developing educational materials on micronutrient intake for a general adult audience, Which of the following approaches best aligns with the educator's scope of practice and U.S. public health guidelines for promoting micronutrient adequacy? Option A. Providing general dietary recommendations that highlight food groups rich in essential micronutrients and encourage a varied diet. Option B. Encouraging all participants to take a daily multivitamin supplement to ensure they meet their micronutrient needs. Option C. Creating individualized meal plans for participants who express concerns about not getting enough vitamins and minerals. Option D. Advising individuals to consult a physician for blood tests to determine specific micronutrient deficiencies, and then recommending specific supplements. The correct answer is A. Providing general dietary recommendations that highlight food groups rich in essential micronutrients and encourage a varied diet. Explanation. The control framework reveals that a community health educator is tasked with developing educational materials on micronutrient deficiencies for a diverse population. This scenario is professionally challenging because it requires translating complex scientific information about micronutrients into accessible and actionable advice for individuals with varying levels of health literacy, cultural backgrounds, and dietary habits. The educator must ensure the information is accurate, evidence-based, and aligns with current U.S. dietary guidelines and public health recommendations without overstepping professional boundaries or providing medical advice. The correct approach represents best professional practice because it prioritizes evidence-based information and empowers individuals through education. By focusing on general dietary recommendations for obtaining essential micronutrients from food sources, the educator adheres to the scope of practice for a community health educator. This approach aligns with the U.S. regulatory framework for nutrition education, which emphasizes promoting healthy eating patterns and preventing deficiencies through informed food choices, as outlined by agencies like the USDA and HHS. It respects the role of healthcare professionals in diagnosing and treating specific deficiencies. An incorrect approach that focuses on recommending specific dietary supplements without a prior diagnosis by a qualified healthcare provider represents a significant regulatory and ethical failure. This crosses the line into providing medical advice, which is outside the scope of practice for a community health educator. Such recommendations could lead to inappropriate self-treatment, potential adverse effects from oversupplementation, or masking of underlying health issues that require medical attention. This violates the principle of practicing within one's scope and could contravene guidelines from professional organizations that emphasize collaboration with healthcare providers. Another incorrect approach that involves creating personalized meal plans for individuals with suspected micronutrient deficiencies is also professionally unacceptable. While well-intentioned, this also ventures into the realm of medical nutrition therapy, which is the purview of registered dietitians or licensed nutritionists. Without a formal assessment and diagnosis, providing personalized meal plans can be inaccurate, ineffective, and potentially harmful. It bypasses the necessary diagnostic process and can lead to mismanaged health conditions. A third incorrect approach that emphasizes the immediate need for all individuals to take a broad-spectrum micronutrient supplement to prevent any potential deficiency is also flawed. This promotes a blanket recommendation that is not evidence-based for the general population and can lead to unnecessary expense and potential overconsumption of certain micronutrients. Public health guidance generally focuses on achieving micronutrient adequacy through a balanced diet, with supplementation considered on an individual basis under the guidance of a healthcare professional. The professional decision-making process for similar situations should involve a clear understanding of one's scope of practice as defined by professional standards and relevant U.S. regulations. Professionals should always prioritize providing accurate, evidence-based information that empowers individuals to make informed choices. When dealing with potential health conditions or specific nutritional needs that fall outside their expertise, the ethical and professional responsibility is to refer individuals to appropriate healthcare providers, such as physicians or registered dietitians. Continuous professional development and staying abreast of current guidelines from authoritative bodies like the Dietary Guidelines for Americans are crucial for maintaining competence and ethical practice. Question 3. Stakeholder feedback indicates a need for clearer guidance on how to obtain adequate vitamins through diet, particularly concerning the differences between fat-soluble and water-soluble vitamins and how to avoid common deficiencies prevalent in the American diet without resorting to excessive supplementation. Which of the following approaches best addresses these concerns within the scope of nutrition education? Option A. Provide a detailed overview of the chemical structures and absorption pathways of all fat-soluble and water-soluble vitamins, followed by a list of common deficiency diseases and their symptoms. Option B. Focus on the potential toxicity of fat-soluble vitamins and advise stakeholders to limit their intake of foods rich in these vitamins to avoid adverse effects. Option C. Educate stakeholders on the importance of a balanced diet rich in fruits, vegetables, whole grains, and lean proteins, highlighting specific food sources for key vitamins, e.g., leafy greens for vitamin K, citrus fruits for vitamin C, fatty fish for vitamin D, and explaining how to incorporate them into daily meals to meet needs and prevent deficiencies. Option D. Recommend specific over-the-counter vitamin supplements for each type of vitamin, providing dosage recommendations based on general population guidelines to ensure adequate intake. The correct answer is A. Provide a detailed overview of the chemical structures and absorption pathways of all fat-soluble and water-soluble vitamins, followed by a list of common deficiency diseases and their symptoms. Explanation. Scenario analysis. This scenario presents a common challenge in nutrition education where a diverse group of individuals, potentially with varying levels of health literacy and dietary habits, require tailored advice. The professional must navigate the complexities of vitamin metabolism, absorption, and potential toxicity, ensuring recommendations are both scientifically sound and practically applicable within the context of typical American diets. The challenge lies in translating scientific knowledge about fat-soluble versus water-soluble vitamins into actionable guidance that addresses common deficiencies and prevents overconsumption, all while adhering to U.S. regulatory guidelines for nutrition information. Correct approach analysis. The correct approach emphasizes providing evidence-based, practical dietary strategies that leverage food sources to meet vitamin needs. This aligns with U.S. dietary guidelines, such as those from the USDA and FDA, which promote a balanced diet rich in fruits, vegetables, whole grains, and lean proteins as the primary means of obtaining essential nutrients. Focusing on food sources is crucial because it addresses potential deficiencies, e.g., vitamin D in individuals with limited sun exposure, vitamin A in those with poor intake of colorful produce, and also implicitly guides away from excessive supplementation, which can lead to toxicity, particularly with fat-soluble vitamins, A, D, E, K. This approach respects the principle of food first and avoids making specific medical claims or recommending dosages, which would fall outside the scope of a nutrition educator and potentially violate FDA regulations regarding dietary supplements and health claims. Incorrect approaches analysis. One incorrect approach involves solely focusing on the biochemical differences between fat-soluble and water-soluble vitamins without translating this into practical dietary advice. This fails to meet the stakeholders' need for actionable guidance and can be overwhelming or irrelevant to individuals seeking to improve their diet. It also risks oversimplifying complex nutritional needs and may not adequately address common deficiency patterns in the U.S. population. Another incorrect approach is to recommend specific vitamin supplements without a thorough individual assessment and medical referral. This is a significant regulatory and ethical failure. Nutrition educators are not licensed to prescribe supplements, and doing so could be construed as practicing medicine without a license. Furthermore, the FDA regulates dietary supplements, and making specific recommendations without proper qualification can lead to legal repercussions and harm to the individual if the supplement is inappropriate or interacts with existing medical conditions or medications. This approach also bypasses the food-first principle and can lead to unnecessary expense and potential toxicity. A third incorrect approach is to provide generalized information about vitamin deficiencies without linking it to specific food groups or dietary patterns relevant to the U.S. population. While informative, this lacks the practical application needed by stakeholders. It fails to empower individuals with the knowledge of how to actively incorporate nutrient-rich foods into their daily meals, thus not effectively addressing the root causes of potential deficiencies. Professional reasoning. Professionals in this field should adopt a decision-making process that prioritizes evidence-based nutrition education, focusing on empowering individuals to make informed dietary choices. This involves 1. Understanding the target audience's needs and current dietary patterns. 2. Applying knowledge of U.S. dietary guidelines and nutrient recommendations. 3. Emphasizing whole foods as the primary source of vitamins. 4. Educating on the functions and sources of vitamins, highlighting common deficiency risks and strategies for prevention through diet. 5. Recognizing the limitations of their scope of practice, particularly regarding medical advice and supplement recommendations, and knowing when to refer individuals to registered dietitians or healthcare providers. 6. Adhering strictly to FDA and USDA guidelines regarding nutrition information and health claims. Question 4. The efficiency study reveals that a community group is exploring various food preservation methods for surplus produce. A family and consumer sciences professional is tasked with advising them on the safest and most effective approaches for canning, freezing, and drying. Which of the following approaches best reflects a risk assessment-driven, scientifically sound recommendation for these methods? Option A. Recommend canning methods that prioritize speed and minimal energy use, freezing techniques that focus on bulk storage regardless of packaging integrity, and drying processes that rely on ambient air circulation for moisture removal. Option B. Suggests that all preservation methods are generally safe and that minor deviations from recommended times or temperatures are acceptable as long as the food appears visually unspoiled. Option C. Advise on canning procedures that adhere to scientifically validated recipes and processing times for specific food types, freezing methods that ensure rapid temperature reduction and appropriate packaging to maintain quality, and drying techniques that achieve a target moisture content to inhibit microbial growth. Option D. Emphasize the historical practices of food preservation within the community, encouraging the use of traditional methods without necessarily verifying their current scientific validity or safety standards. The correct answer is A. Recommend canning methods that prioritize speed and minimal energy use, freezing techniques that focus on bulk storage regardless of packaging integrity, and drying processes that rely on ambient air circulation for moisture removal. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires a family and consumer sciences professional to evaluate the safety and efficacy of food preservation methods in a home setting, directly impacting the health and well-being of consumers. The challenge lies in balancing the desire for cost-effective and accessible preservation techniques with the absolute necessity of adhering to established food safety guidelines to prevent foodborne illnesses. Misinformation or improper application of these methods can have severe consequences. Correct approach analysis. The correct approach emphasizes understanding the scientific principles behind each preservation method and their specific application to different food types, aligning with best practices for food safety. This involves recognizing that while canning, freezing, and drying are all valid methods, their effectiveness and safety depend on precise execution. For canning, this means adhering to tested recipes and processing times to ensure proper heat penetration and destruction of harmful microorganisms. For freezing, it involves rapid freezing to maintain food quality and prevent ice crystal formation, along with appropriate packaging to avoid freezer burn. For drying, it requires achieving a low enough moisture content to inhibit microbial growth, often necessitating specific temperature and time parameters. This approach prioritizes consumer safety by ensuring that the chosen method is appropriate for the food being preserved and is executed according to scientifically validated guidelines, thereby minimizing the risk of spoilage and foodborne illness. This aligns with the ethical obligation of a CFCS professional to provide accurate and safe guidance. Incorrect approaches analysis. One incorrect approach focuses solely on the perceived cost-effectiveness of a preservation method without adequately considering its safety implications. For instance, advocating for a less rigorous canning process because it saves time or energy without ensuring it meets the necessary thermal processing requirements is a significant food safety failure. This disregards the potential for survival of pathogens like Clostridium botulinum, which can produce deadly toxins in improperly canned low-acid foods. Another incorrect approach might prioritize convenience over established safety protocols. This could manifest as recommending shorter freezing times than necessary, or using inadequate packaging for dried foods, leading to spoilage and potential health risks. Such an approach fails to acknowledge that, while these methods are generally safe, deviations from recommended practices can compromise food integrity and safety. A third incorrect approach could involve generalizing the application of a preservation method across all food types without considering the unique properties of each. For example, applying a general drying time to all fruits and vegetables without accounting for their varying moisture content and density would be a failure. This oversight can lead to foods that are not sufficiently dried, remaining susceptible to microbial growth and spoilage, or conversely, being over-dried and losing nutritional value unnecessarily. Each method requires specific knowledge and application tailored to the food item. Professional reasoning. Professionals should approach food preservation guidance by first identifying the specific food item to be preserved. Then, they should assess the most appropriate preservation method based on the food's characteristics, the desired shelf life, and available resources, always prioritizing safety. This involves consulting reliable, evidence-based resources such as university extension publications or government food safety guidelines. A thorough understanding of the scientific principles underlying each method is crucial. Professionals must then communicate these principles and the precise steps required for safe and effective application to consumers, emphasizing that adherence to recommended procedures is non-negotiable for preventing foodborne illness. The decision-making process should always begin with a risk assessment, identifying potential hazards associated with each preservation method and implementing controls to mitigate those risks. Question 5. Assessment of a pregnant client's dietary habits reveals a strong adherence to traditional cultural practices that limit the consumption of certain food groups commonly recommended for increased nutrient intake during pregnancy. The client expresses a desire to maintain these traditions while also ensuring a healthy pregnancy. What is the most appropriate initial approach for the family and consumer sciences professional? Option A. Focus on the potential challenges and difficulties the client's cultural food practices might present for meeting pregnancy nutrient needs, and suggest she consider modifying her traditions for the sake of her baby's health. Option B. Explore the client's specific cultural food practices in detail. Identify key nutrients that may be inadequately consumed due to these practices, and collaboratively develop strategies to incorporate nutrient-dense alternatives or supplements that align with her cultural values and preferences. Option C. Provide the client with a standard pregnancy nutrition guideline handout and explain why the recommended food groups are essential, encouraging her to gradually incorporate them despite her cultural preferences. Option D. Gently question the client's adherence to traditional practices, suggesting that modern nutritional science offers more effective ways to ensure a healthy pregnancy, and recommend she prioritize scientific recommendations over cultural norms. The correct answer is B. Explore the client's specific cultural food practices in detail. Identify key nutrients that may be inadequately consumed due to these practices, and collaboratively develop strategies to incorporate nutrient-dense alternatives or supplements that align with her cultural values and preferences. Explanation. This scenario is professionally challenging because it requires a family and consumer sciences professional to navigate a client's personal beliefs and cultural practices while ensuring the nutritional well-being of both the mother and the developing fetus. The challenge lies in balancing respect for autonomy with the responsibility to provide evidence-based, safe, and effective nutritional guidance. The professional must avoid imposing personal values or making assumptions, instead focusing on collaborative goal setting and education. The correct approach represents best professional practice because it prioritizes a client-centered, evidence-based, and culturally sensitive strategy. It involves active listening, open-ended questioning, and collaborative development of a personalized nutrition plan. This aligns with ethical guidelines that emphasize client autonomy, informed consent, and the provision of accurate, non-judgmental information. Specifically, it adheres to the principles of professional conduct that require practitioners to respect diverse values and beliefs while upholding their duty to promote health and safety. The focus on identifying specific nutrient concerns and exploring practical, culturally acceptable solutions demonstrates a commitment to individualized care and effective health promotion. An incorrect approach that relies solely on generalized dietary recommendations without understanding the client's specific context fails to acknowledge individual needs and preferences, potentially leading to non-adherence and suboptimal outcomes. This approach is ethically problematic as it can be perceived as dismissive of the client's lived experience and cultural background. Another incorrect approach that involves directly challenging or dismissing the client's stated preferences without first understanding their rationale is a significant ethical failure. It undermines the therapeutic relationship, erodes trust, and can lead to the client disengaging from professional support. Such an approach violates the principle of respect for persons and can be seen as paternalistic. A third incorrect approach that focuses on the perceived difficulty of the client's preferences rather than finding solutions is unprofessional and unhelpful. It shifts the focus from client well-being to the professional's convenience and demonstrates a lack of problem-solving skills and empathy. The professional decision-making process for similar situations should involve a structured approach. First, establish rapport and actively listen to the client's concerns and preferences. Second, gather comprehensive information about their current dietary habits, cultural practices, and any perceived barriers. Third, use open-ended questions to explore the rationale behind their choices. Fourth, provide evidence-based information about the nutritional needs during pregnancy, explaining the importance of specific nutrients in a clear and understandable manner. Fifth, collaboratively develop a personalized nutrition plan that respects the client's values while addressing identified nutritional gaps and promoting optimal health for mother and baby. Finally, offer ongoing support and reassessment. Question 6. Comparative studies suggest that while all carbohydrates provide energy, their physiological impact and recommended dietary intake can vary significantly. Considering the U.S. regulatory framework for nutrition guidance, which of the following best describes the functional differences between carbohydrate types and their implications for consumer advice? Option A. The digestion and metabolism of all carbohydrate types are solely dependent on individual genetics, making generalized dietary recommendations regarding carbohydrate intake ineffective and potentially misleading. Option B. Complex carbohydrates, such as those found in whole grains, are primarily digested into glucose, providing sustained energy and fiber, while simple carbohydrates like added sugars are rapidly absorbed, leading to quick energy spikes and potential nutrient displacement. Option C. Simple carbohydrates are essential for immediate muscle glycogen replenishment during intense exercise, and their consumption should be prioritized over complex carbohydrates for optimal athletic performance, regardless of other health considerations. Option D. All carbohydrates are metabolized identically by the body, with the primary difference being their caloric density, and therefore, consumers should focus solely on total carbohydrate intake for energy management. The correct answer is B. Complex carbohydrates, such as those found in whole grains, are primarily digested into glucose, providing sustained energy and fiber, while simple carbohydrates like added sugars are rapidly absorbed, leading to quick energy spikes and potential nutrient displacement. Explanation. Scenario analysis. This scenario presents a professional challenge for a certified in Family and Consumer Sciences (CFCS) professional by requiring them to interpret and apply nutritional information in a way that is both scientifically accurate and compliant with U.S. regulatory frameworks, specifically those governing dietary guidance and consumer information. The challenge lies in distinguishing between the physiological roles of different carbohydrate types and their implications for public health recommendations, ensuring that advice aligns with established U.S. guidelines without misrepresenting scientific findings or making unsubstantiated claims. Careful judgment is required to navigate the nuances of carbohydrate metabolism and its impact on health, translating complex scientific concepts into practical, actionable advice for consumers. Correct approach analysis. The correct approach accurately reflects the U.S. regulatory framework by emphasizing the distinction between simple and complex carbohydrates and their respective roles in energy provision and nutrient density. It aligns with U.S. dietary guidelines that promote the consumption of whole grains and fiber-rich foods, which are sources of complex carbohydrates, while advising moderation in the intake of added sugars, often found in simple carbohydrates. This approach is best professional practice because it is grounded in evidence-based nutrition science and adheres to the principles of consumer education as outlined by U.S. health authorities. It avoids making definitive health claims that could be misconstrued or violate regulations regarding unsubstantiated health benefits. Incorrect approaches analysis. An approach that focuses solely on the caloric content of all carbohydrates without differentiating their types and metabolic pathways fails to acknowledge the qualitative differences in how the body processes simple versus complex carbohydrates. This oversight can lead to oversimplified and potentially misleading dietary advice, neglecting the importance of nutrient density and the glycemic response associated with different carbohydrate sources, which are key considerations in U.S. dietary recommendations. Another incorrect approach might overemphasize the immediate energy release of simple sugars without discussing their potential impact on blood glucose levels and the risk of associated health issues, which is a critical aspect of U.S. public health messaging on sugar intake. This approach neglects the long-term health implications and the recommendations for limiting added sugars. A further incorrect approach could misattribute specific disease prevention or treatment capabilities to certain carbohydrate types without robust scientific backing or regulatory approval for such claims. This would violate regulations against making unsubstantiated health claims and could mislead consumers about the direct therapeutic benefits of specific dietary components. Professional reasoning. Professionals should adopt a decision-making process that prioritizes adherence to established U.S. dietary guidelines and regulatory frameworks. This involves understanding the scientific basis of nutrition, critically evaluating research, and translating this knowledge into consumer advice that is accurate, practical, and compliant. When faced with interpreting nutritional information, professionals should ask, does this align with current U.S. dietary recommendations? Are there any potential regulatory implications for the advice I am providing? Is the information I am conveying scientifically sound and free from unsubstantiated claims? This systematic approach ensures that advice is both effective and ethically responsible. Question 7. Cost-benefit analysis shows that offering a popular, highly palatable processed snack as a reward for consuming a small portion of vegetables might increase immediate vegetable intake. But what is the most ethically sound and professionally responsible approach for a nutrition professional advising a parent on their child's dietary habits? Option A. Educate the parent on the nutritional value of a variety of nutrient-dense foods and discuss strategies for gradually introducing and making vegetables more appealing, while acknowledging the child's preferences and the parent's desire for positive reinforcement. Option B. Suggest that the child's preferences are paramount and that focusing on nutrient-dense foods can be delayed until the child is older and more receptive. Option C. Recommend the processed snack as a consistent reward for vegetable consumption, emphasizing that any vegetable intake, even with a reward, is better than none. Option D. Advise the parent to simply insist the child eats the vegetables without any discussion or alternative, as this is the only way to ensure proper nutrition. The correct answer is A. Educate the parent on the nutritional value of a variety of nutrient-dense foods and discuss strategies for gradually introducing and making vegetables more appealing, while acknowledging the child's preferences and the parent's desire for positive reinforcement. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a nutrition professional to balance the immediate, tangible benefits of a popular, albeit less nutrient-dense, food product with the long-term, less visible health implications for a growing child. The pressure to cater to a child's preferences, often reinforced by parental desires for a peaceful mealtime, can conflict with evidence-based nutritional recommendations. Navigating these competing demands while adhering to professional standards and ethical obligations to promote optimal health requires careful judgment. Correct approach analysis. The correct approach represents best professional practice because it prioritizes the child's long-term health and well-being, aligning with the core ethical principles of beneficence and non-maleficence in nutrition practice. It acknowledges the parent's concerns and the child's preferences, but frames the discussion within the context of established dietary guidelines and the importance of nutrient-dense foods for growth and development. This approach empowers the parent with accurate information to make informed decisions, fostering a collaborative relationship and promoting sustainable, healthy eating habits. It also implicitly adheres to the spirit of any relevant U.S. regulations concerning the promotion of healthy eating, particularly for vulnerable populations like children, by advocating for evidence-based practices. Incorrect approaches analysis. One incorrect approach fails by solely focusing on the immediate satisfaction of the child and parent, disregarding the potential for negative long-term health consequences. This approach prioritizes convenience and immediate appeasement over evidence-based nutritional science, potentially contributing to poor dietary patterns and associated health risks, which is an ethical failure to act in the best interest of the client. Another incorrect approach might involve dismissing the parent's concerns or the child's preferences outright without offering constructive alternatives. This can alienate the client, damage the professional relationship, and lead to noncompliance with recommendations. Ethically, it fails to demonstrate respect for the client's autonomy and can be perceived as judgmental, hindering effective nutrition counseling. A third incorrect approach could be to provide generic, unspecific advice without tailoring it to the child's specific needs or the family's circumstances. This lacks the depth of analysis required for effective nutrition intervention and may not be actionable for the family, thus failing to meet the professional standard of care. Professional reasoning. Professionals should employ a decision-making framework that begins with active listening to understand the client's concerns, preferences, and challenges. This is followed by an assessment of the client's nutritional status and needs, drawing upon current scientific evidence and established dietary guidelines. The next step involves developing personalized, evidence-based recommendations that are practical and achievable within the client's context. Finally, the professional should engage in collaborative goal setting and provide ongoing support and education, empowering the client to make informed choices that promote long-term health. This iterative process ensures that recommendations are both scientifically sound and culturally sensitive, fostering trust and promoting positive health outcomes. Question 8. To address the challenge of a middle-aged adult client who expresses a strong preference for a highly restrictive and unconventional dietary pattern they discovered online, which approach best upholds professional ethics and promotes informed decision-making? Option A. Actively listen to the client's reasons for adopting this diet. Explain the known nutritional implications of such restrictions using clear, evidence-based language, and collaboratively explore how to meet their nutritional needs within their chosen framework or discuss potential modifications. Option B. Acknowledge the client's interest in the diet but refrain from offering any specific nutritional advice or critique, as their personal choices are paramount. Option C. Immediately advise the client that their chosen diet is unhealthy and strongly recommend they adopt a standard, widely accepted healthy eating pattern instead. Option D. Present the client with extensive scientific research papers detailing the potential risks of restrictive diets, assuming they will be able to interpret and apply the information independently. The correct answer is A. Actively listen to the client's reasons for adopting this diet. Explain the known nutritional implications of such restrictions using clear, evidence-based language, and collaboratively explore how to meet their nutritional needs within their chosen framework, or discuss potential modifications. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires balancing a client's expressed preferences with evidence-based nutritional recommendations, particularly when those preferences might have potential health implications. The Certified in Family and Consumer Sciences, CFCS, professional must navigate the ethical imperative to respect client autonomy while also upholding their responsibility to provide accurate and safe nutritional guidance. The age of the client, middle-aged adult, adds a layer of consideration, as nutritional needs and potential risks can evolve with age. The professional must also consider the potential for misinformation influencing the client's choices. Correct approach analysis. The correct approach involves actively listening to the client's concerns and understanding the reasoning behind their dietary choices, then providing clear, evidence-based information about the nutritional implications of their chosen diet. This approach respects client autonomy by acknowledging their right to make choices, while also fulfilling the professional's duty to educate and guide. It aligns with ethical principles of beneficence, acting in the client's best interest and non-maleficence, avoiding harm, by offering accurate information that can help the client make informed decisions. The CFCS professional's role is to empower clients with knowledge, not to dictate their choices. This approach also implicitly adheres to any relevant U.S. federal guidelines regarding nutrition education and counseling, which emphasize informed consent and client-centered care. Incorrect approaches analysis. One incorrect approach involves immediately dismissing the client's chosen diet and insisting on a universally recommended, healthy eating pattern without understanding the client's perspective. This fails to respect client autonomy and can alienate the client, making them less receptive to any advice. It also bypasses the crucial step of understanding the client's motivations and potential underlying issues. Ethically, this could be seen as paternalistic and lacking in empathy. Another incorrect approach is to simply agree with the client's dietary choices without offering any nutritional information or guidance, even if those choices appear to be suboptimal or potentially harmful. This abdicates the professional responsibility to provide evidence-based advice and could lead to negative health outcomes for the client. It fails the duty of care and could be considered negligent. A third incorrect approach is to present complex scientific jargon or overwhelming amounts of data without tailoring it to the client's understanding or addressing their specific concerns. While factually correct, this approach is ineffective in facilitating informed decision-making and can be intimidating, hindering the client's ability to engage with the information. It fails to meet the client where they are and prioritize their comprehension. Professional reasoning. Professionals should employ a client-centered approach that prioritizes active listening, empathy, and clear communication. The process involves 1. Establishing rapport and understanding the client's current situation and goals. 2. Eliciting the client's rationale for their choices. 3. Providing accurate, evidence-based information in an understandable format, addressing potential benefits and risks. 4. Collaborating with the client to develop a plan that aligns with their preferences and health objectives, while ensuring it is nutritionally sound. This iterative process ensures that recommendations are both effective and respected. Question 9. The efficiency study reveals that a new mother is struggling to maintain adequate energy and nutrient intake to support breastfeeding. She expresses concern about feeling constantly fatigued and worries about the quality of her breast milk. She has heard conflicting advice from friends and online sources regarding specific foods to consume or avoid. Which of the following approaches best supports this mother's nutritional needs during lactation? Option A. Advise her to focus primarily on consuming large quantities of water and simple carbohydrates to boost energy levels, and suggest she limit other food groups to avoid potential digestive issues for the baby. Option B. Provide a generic list of superfoods commonly recommended for breastfeeding mothers, emphasizing high protein and high fat options, and advise her to increase her overall food intake significantly without specific guidance on macronutrient balance. Option C. Recommend she strictly adhere to a popular fad diet that promises rapid weight loss and increased energy, as this is often discussed in online parenting forums, and assure her that it will improve her milk supply. Option D. Conduct a comprehensive dietary assessment to understand her current intake, lifestyle, and preferences. Then develop a personalized meal plan incorporating evidence-based recommendations for lactating mothers, focusing on nutrient-dense foods and adequate hydration, while addressing her specific concerns about fatigue and milk quality. The correct answer is D. Conduct a comprehensive dietary assessment to understand her current intake, lifestyle, and preferences. Then develop a personalized meal plan incorporating evidence-based recommendations for lactating mothers, focusing on nutrient-dense foods and adequate hydration, while addressing her specific concerns about fatigue and milk quality. Explanation. This scenario is professionally challenging because it requires a family and consumer sciences professional to balance evidence-based nutritional recommendations with individual client needs and potential cultural or personal beliefs, all while adhering to professional ethical guidelines and potentially specific state or federal regulations regarding nutrition counseling. The professional must navigate the complexities of lactation, a period with unique nutritional demands, and ensure the advice provided is safe, effective, and respectful. The correct approach represents best professional practice because it prioritizes a comprehensive, individualized assessment. This involves gathering detailed information about the mother's current diet, lifestyle, health status, and breastfeeding goals. It then integrates this information with established, evidence-based guidelines for lactation nutrition, such as those from the Academy of Nutrition and Dietetics or relevant public health organizations. The professional's role is to translate these guidelines into practical, actionable advice tailored to the client's specific circumstances, empowering her to make informed decisions. This approach aligns with ethical principles of beneficence, acting in the client's best interest, and autonomy, respecting the client's right to make choices. It also implicitly adheres to any applicable state licensing laws or professional association standards that mandate evidence-based practice and client-centered care. An incorrect approach that focuses solely on generalized dietary recommendations without assessing individual needs fails to acknowledge the unique physiological and lifestyle factors influencing a lactating mother. This could lead to advice that is impractical, insufficient, or even detrimental. Ethically, it breaches the duty of care by not providing personalized guidance. It may also violate professional standards that require individualized care plans. Another incorrect approach that relies on anecdotal evidence or unverified popular trends, rather than established scientific literature, is a significant ethical and professional failure. This can expose the mother and infant to potentially harmful practices or misinformation, undermining the credibility of the profession and potentially violating regulations that require practitioners to provide evidence-based information. A third incorrect approach that imposes a rigid, one-size-fits-all dietary plan without considering the client's preferences, cultural background, or socioeconomic status is also professionally unacceptable. This disregards the principle of cultural competence and can lead to non-adherence and frustration for the client. It fails to recognize that successful nutritional interventions are sustainable and integrated into the client's life. The professional decision-making process for similar situations should involve a systematic approach. 1. Client assessment. Conduct a thorough intake to understand the client's history, current status, goals, and any barriers. 2. Evidence review. Access and apply current, evidence-based nutritional guidelines relevant to lactation. 3. Individualization. Tailor recommendations to the client's unique needs, preferences, and circumstances. 4. Education and empowerment. Provide clear, understandable information and support the client in making informed choices. 5. Monitoring and follow-up. Regularly assess progress and adjust recommendations as needed. 6. Ethical and regulatory adherence. Ensure all advice and practices comply with professional codes of ethics and relevant laws. Question 10. Operational review demonstrates that a new snack bar formulation is being considered for market launch. The product development team has gathered feedback from a small group of internal employees who have tasted the bar and provided general comments on its flavor. To expedite the launch, the team is proposing to proceed based on these informal comments without further sensory testing. Which of the following approaches best aligns with professional standards and regulatory expectations for sensory evaluation in this context? Option A. Conduct a series of informal taste tests with untrained individuals in various casual settings, encouraging them to share their immediate reactions to the snack bar's taste. Option B. Implement a structured sensory evaluation using a trained panel to assess specific attributes of taste, texture, and aroma, followed by a consumer panel to gauge overall liking and purchase intent, ensuring data is statistically analyzed. Option C. Proceed with the launch based on the internal employee feedback, assuming that if the flavor is acceptable to them, it will be acceptable to the general consumer market. Option D. Focus solely on optimizing the sweetness and saltiness of the snack bar based on the internal feedback, as these are the primary drivers of taste perception. The correct answer is B. Implement a structured sensory evaluation using a trained panel to assess specific attributes of taste, texture, and aroma, followed by a consumer panel to gauge overall liking and purchase intent, ensuring data is statistically analyzed. Explanation. Scenario analysis. This scenario presents a common challenge in food product development and quality assurance, where subjective sensory attributes must be objectively assessed to ensure consumer satisfaction and product consistency. The challenge lies in translating individual perceptions of taste, texture, and aroma into actionable data that can inform product formulation and marketing, all while adhering to established food safety and labeling regulations. The professional must navigate potential biases in sensory perception and ensure that the evaluation process is both scientifically sound and ethically transparent. Correct approach analysis. The correct approach involves employing a structured sensory evaluation protocol that utilizes trained panelists or a well-defined consumer panel, coupled with standardized testing conditions and appropriate statistical analysis. This method ensures that the data collected is reliable, reproducible, and representative of the target consumer group's preferences. Adherence to guidelines from organizations like the Institute of Food Technologists, IFT, or relevant food industry standards for sensory evaluation is crucial for maintaining scientific integrity and meeting regulatory expectations for product claims and quality. This approach minimizes bias and provides objective data to support product development decisions, ensuring compliance with consumer protection laws and industry best practices. Incorrect approach is analysis. One incorrect approach is relying solely on the opinions of a few internal staff members without a systematic evaluation process. This is ethically problematic as it introduces significant bias and is unlikely to reflect the broader consumer base, potentially leading to misrepresentation of the product's sensory qualities. It fails to meet professional standards for objective data collection and could violate regulations related to truthful advertising and product claims. Another incorrect approach is to conduct informal taste tests with untrained individuals without controlling for environmental factors or providing clear instructions. This method yields unreliable and inconsistent data, making it impossible to draw meaningful conclusions about taste, texture, or aroma. It lacks scientific rigor and can lead to flawed product development decisions, potentially resulting in consumer dissatisfaction and reputational damage, and may indirectly lead to noncompliance with regulations requiring products to meet advertised standards. A third incorrect approach is to focus exclusively on one sensory attribute, such as taste, while neglecting texture and aroma. Sensory perception is holistic. All attributes contribute to the overall consumer experience. Ignoring texture and aroma can lead to a product that is perceived negatively overall, even if the taste is acceptable. This incomplete evaluation can result in product failures and may contravene regulation that implicitly require products to meet reasonable consumer expectations for all sensory aspects. Professional reasoning. Professionals should approach sensory evaluation by first defining the objectives of the evaluation and identifying the target consumer. They should then select an appropriate sensory evaluation methodology, whether it involves trained sensory panels for attribute profiling or consumer panels for preference testing. Standardized procedures for sample preparation, presentation, and data collection are essential. Statistical analysis should be used to interpret the data, and findings should be communicated clearly and objectively. Professionals must always consider the ethical implications of their evaluations, ensuring transparency, avoiding bias, and adhering to all relevant food safety, labeling, and consumer protection regulations. Question 11. Market research demonstrates a growing consumer preference for fat-free or low-fat products, coupled with a significant public aversion to saturated and trans fats. As a certified in family and consumer sciences professional, how should you best address this trend in consumer education materials and product recommendations, considering U.S. regulatory frameworks for nutrition information? Option A. Advocate for the complete removal of all saturated and trans fats from food products and dietary recommendations to align with consumer demand and perceived health benefits, without extensive discussion of other fat types. Option B. Advise consumers to eliminate all dietary fats from their diet to achieve optimal health, emphasizing that fat-free is universally the healthiest option. Option C. Promote the concept of healthy fats broadly, encouraging consumers to seek out products labeled as such, without a detailed explanation of the specific types of fats or their scientific classifications. Option D. Educate consumers on the different types of fats, saturated, unsaturated, trans, and essential fatty acids, their roles in the body, and the importance of moderation and balance in the diet, while clearly identifying sources of unhealthy fats and promoting healthier unsaturated fat alternatives. The correct answer is D. Educate consumers on the different types of fats, saturated, unsaturated, trans, and essential fatty acids, their roles in the body, and the importance of moderation and balance in the diet, while clearly identifying sources of unhealthy fats and promoting healthier unsaturated fat alternatives. Explanation. This scenario presents a professional challenge because it requires a certified in family and consumer sciences, CFCS, professional to navigate the complex landscape of consumer perception and scientific evidence regarding dietary fats, while adhering strictly to U.S. regulatory frameworks for nutrition information. The challenge lies in communicating accurate nutritional information without making unsubstantiated health claims or misleading consumers, especially when market trends favor certain ingredients over others due to public perception rather than solely scientific consensus. Careful judgment is required to balance consumer demand with evidence-based nutrition guidance. The correct approach represents best professional practice because it prioritizes consumer education and empowers individuals to make informed choices based on scientific understanding of different fat types. This aligns with the ethical responsibility of a CFCS professional to provide accurate, unbiased information. By focusing on explaining the roles of saturated, unsaturated, and essential fatty acids, and clearly differentiating trans fats, this approach adheres to U.S. FDA guidelines for nutrition labeling and communication, which prohibit misleading claims and require factual representation of food components. It avoids making definitive good or bad pronouncements, instead focusing on context and moderation, which is a scientifically sound and ethically responsible stance. An incorrect approach that focuses solely on removing all saturated and trans fats to meet perceived consumer demand, without educating consumers about the nuances of unsaturated fats and essential fatty acids, fails to provide a comprehensive understanding. This could lead to consumers making suboptimal dietary choices by eliminating beneficial fats. Ethically, this approach is problematic as it prioritizes market trends over evidence-based nutrition education. From a regulatory standpoint, while not directly violating a specific law, it skirts the spirit of promoting informed dietary choices. Another incorrect approach that emphasizes healthy fats without clearly defining what constitutes healthy in the context of different fat types and their roles in the body, and without distinguishing between naturally occurring and industrially produced trans fats, is misleading. This vagueness can lead to consumer confusion and misinterpretation, potentially resulting in the overconsumption of certain fats or the avoidance of others that are beneficial. This approach risks violating regulations against deceptive or misleading nutrition information. A further incorrect approach that promotes the elimination of all fats as a general health strategy, without acknowledging the essential roles of certain fats, is scientifically inaccurate and ethically irresponsible. This extreme stance ignores the vital functions of essential fatty acids and unsaturated fats in the body. It is a failure to provide balanced and evidence-based information, which is a core tenet of professional practice in nutrition. Such an approach could lead to significant health detriments for individuals following this advice. The professional decision-making process for similar situations should involve a thorough review of current scientific literature and U.S. regulatory guidelines, e.g., FDA, USDA. Professionals must critically evaluate market trends against evidence-based nutrition principles. The primary goal should always be to empower consumers with accurate, understandable information that facilitates informed decision-making, rather than simply catering to popular but potentially misinformed opinions. Transparency about the scientific basis for recommendations is crucial. Question 12. Consider a scenario where a client presents with recent blood test results showing elevated serum ferritin and urine tests indicating increased levels of certain B vitamins. The client reports a generally healthy diet, but admits to occasional consumption of fortified cereals and energy drinks. As a certified in family and consumer sciences professional with a nutrition focus, which of the following actions best represents a responsible and ethical approach to addressing these biochemical findings? Option A. Focus solely on the elevated serum ferritin, advising the client that it is a medical issue requiring a physician's diagnosis and offering no further nutritional guidance related to the B vitamin findings. Option B. Immediately advise the client to cease all consumption of fortified foods and supplements to reduce B vitamin intake and recommend a low-iron diet to address the elevated ferritin. Option C. Interpret the elevated serum ferritin as a definitive sign of iron overload and the increased B vitamins as a direct result of the client's diet, then prescribe specific B vitamin supplements to balance the perceived excess. Option D. Recommend a dietary analysis to identify potential sources of iron and B vitamin overconsumption, and discuss the implications of elevated ferritin with the client, suggesting they consult their physician for further medical evaluation of the ferritin levels. The correct answer is D. Recommend a dietary analysis to identify potential sources of iron and B vitamin overconsumption, and discuss the implications of elevated ferritin with the client, suggesting they consult their physician for further medical evaluation of the ferritin levels. Explanation: this scenario is professionally challenging because it requires a nutrition professional to interpret complex biochemical data within the context of a client's overall health and dietary intake, while adhering to established professional standards and ethical guidelines. The challenge lies in moving beyond simply reporting lab values to providing actionable, evidence-based nutritional recommendations that are safe and effective for the individual. Careful judgment is required to differentiate between normal physiological variations, potential nutrient deficiencies or excesses, and markers that may indicate underlying medical conditions requiring physician referral. The correct approach represents best professional practice because it prioritizes a holistic and individualized assessment. By integrating blood and urine test results with a comprehensive dietary assessment and client history, the nutrition professional can identify specific nutrient imbalances or excesses that may be influenced by diet. This approach aligns with the ethical responsibility to provide competent and evidence-based nutrition care, ensuring that recommendations are tailored to the client's unique needs and do not inadvertently cause harm. It also respects the scope of practice by recognizing when medical interpretation is needed and when nutritional interventions are appropriate. An incorrect approach that focuses solely on reporting elevated or depressed blood glucose levels without considering the client's dietary intake or symptoms fails to provide a complete nutritional picture. This could lead to misinterpretation of the data and potentially inappropriate dietary advice. Ethically, it is a failure to provide comprehensive care and could be considered negligent if it leads to adverse outcomes. Another incorrect approach that involves recommending high-dose nutrient supplements based on a single abnormal urine test result without further investigation or consideration of potential interactions or contraindications is also professionally unacceptable. This bypasses the need for a thorough assessment and could lead to nutrient toxicity or masking of underlying medical issues. It violates the principle of do no harm and demonstrates a lack of professional due diligence. A third incorrect approach that involves making a diagnosis based on biochemical markers without being a licensed medical practitioner is a clear violation of professional boundaries and regulatory frameworks. Nutrition professionals are not authorized to diagnose medical conditions, and doing so can have serious legal and ethical consequences, potentially endangering the client's health. The professional decision-making process for similar situations should involve a systematic approach. 1. Review all available biochemical data, blood and urine tests, in conjunction with the client's medical history, current medications, and reported symptoms. 2. Compare test results against established reference ranges, understanding that these ranges can vary and that individual physiological variations exist. 3. Conduct a thorough dietary assessment to identify potential dietary contributors to observed biochemical findings. 4. Synthesize all information to identify potential nutritional concerns or areas for intervention. 5. If biochemical markers suggest a medical condition, refer the client to a physician for further medical evaluation and diagnosis. 6. Develop individualized, evidence-based nutrition recommendations that address identified nutritional needs or imbalances, considering the client's lifestyle, preferences, and goals. 7. Document all assessments, recommendations, and referrals thoroughly. 8. Continuously monitor the client's progress and adjust recommendations as needed, reevaluating biochemical data if appropriate, and in consultation with healthcare providers. Question 13. The investigation demonstrates a nutrition educator providing guidance on healthy eating to a community group in the United States. The educator is tasked with explaining how to build a balanced meal using the established federal dietary guidance. Which of the following approaches best aligns with the regulatory framework and intent of My Plate? Option A. Advise participants to prioritize protein sources at every meal. Protein is the most crucial nutrient for satiety and muscle maintenance. Option B. Suggest that participants disregard My Plate as it is an oversimplified model and instead consult individual scientific research papers for optimal dietary choices. Option C. Focus on achieving specific macronutrient ratios, such as 40% carbohydrates, 30% protein, and 30% fat, as the primary determinant of a healthy meal. Option D. Emphasize filling half the plate with fruits and vegetables, a quarter with lean protein, and a quarter with whole grains, while also including a serving of dairy or a calcium-fortified alternative. Correct answer is D. Emphasize filling half the plate with fruits and vegetables, a quarter with lean protein, and a quarter with whole grains, while also including a serving of dairy or a calcium-fortified alternative. Explanation. The investigation demonstrates a common challenge faced by nutrition professionals, translating broad dietary guidelines into practical, actionable advice for diverse populations. The scenario requires careful judgment to ensure recommendations are not only scientifically sound, but also align with established, accessible frameworks like MyPlate, which is the primary dietary guidance system for the United States. The professional challenge lies in accurately representing the MyPlate recommendations while avoiding oversimplification or misinterpretation that could lead to suboptimal dietary choices. The correct approach represents best professional practice because it directly and accurately reflects the core principles of MyPlate. It emphasizes the proportional representation of food groups on a plate, which is the visual and conceptual foundation of the guidance. This approach is ethically sound and compliant with U.S. dietary guidelines as it promotes a balanced intake across all food groups, encouraging variety and nutrient density. It empowers individuals with a clear, easy-to-understand model for building healthy meals. An incorrect approach that focuses solely on macronutrient percentages without referencing the food groups fails to adhere to the MyPlate framework. This is a regulatory failure because MyPlate is the official U.S. guidance, and deviating from its core visual and conceptual structure misrepresents the intended message. Ethically, it could lead to confusion and potentially unbalanced diets if individuals prioritize macronutrient targets over the variety and nutrient profiles offered by specific food groups. Another incorrect approach that prioritizes a single food group as the most important for health overlooks the fundamental principle of balance inherent in MyPlate. This is a regulatory failure as it contradicts the balanced representation of all food groups. Ethically, it can lead to nutrient deficiencies and an unbalanced dietary pattern, which is contrary to the public health goals of dietary guidance. A further incorrect approach that suggests MyPlate is outdated and should be replaced by more complex, research-based models, while potentially having merit in advanced nutritional science, is a regulatory and ethical failure in the context of providing guidance based on established frameworks. Professionals are expected to utilize and interpret official guidance systems. Introducing unverified or overly complex alternatives without proper context or justification can undermine public trust and lead to confusion, failing to meet the immediate need for clear, accessible dietary advice. The professional decision-making process for similar situations should involve 1. Identifying the primary regulatory framework applicable to the target audience, in this case, MyPlate for the U.S. 2. Understanding the core principles and visual representation of that framework. 3. Translating these principles into clear, actionable advice that respects the diversity of food choices within each group. 4. Ensuring that any supplementary information or advice complements, rather than contradicts, the official guidance. 5. Prioritizing clarity and accessibility for the intended audience. Question 14. Upon reviewing a client's dietary intake, a nutrition professional identifies several areas for improvement, including increased consumption of fruits and vegetables and reduced intake of processed foods. The client expresses a general desire to eat healthier, but has not previously attempted significant dietary changes and seems overwhelmed by the prospect. Which of the following approaches best reflects the application of behavior change theories to guide the nutrition professional's next steps? Option A. Immediately provide a detailed meal plan with specific recipes and daily calorie targets, emphasizing the long-term health benefits of strict adherence. Option B. Recommend a complete overhaul of the client's pantry and refrigerator, discarding all processed items and replacing them with whole foods to create an immediate healthy environment. Option C. Focus on educating the client about the detailed nutritional science behind processed foods and their negative health impacts, assuming this knowledge will motivate them to change. Option D. Initiate a discussion to explore the client's current perceptions of healthy eating, identify potential barriers to change, and collaboratively set a small, achievable goal related to increasing vegetable intake. The correct answer is A. Immediately provide a detailed meal plan with specific recipes and daily calorie targets, emphasizing the long-term health benefits of strict adherence. Explanation. This scenario presents a common challenge for nutrition professionals, assisting individuals in adopting healthier eating habits, which often requires significant behavior change. The challenge lies in recognizing that individuals are at different stages of readiness to change, and that a one-size-fits-all approach is ineffective. Applying behavior change theories is crucial for tailoring interventions to the client's current state, promoting sustained adherence, and respecting client autonomy. The correct approach leverages the transtheoretical model, TTM, by assessing the client's stage of change and then applying strategies appropriate for that stage. This aligns with ethical practice by respecting the client's readiness and avoiding premature or overly demanding interventions that could lead to discouragement or resistance. It is also consistent with professional guidelines that emphasize client-centered care and evidence-based practice, ensuring interventions are tailored and effective. An incorrect approach would be to immediately implement advanced strategies without assessing the client's readiness. This could involve pushing for drastic dietary changes when the client is not yet contemplating change, which is a failure to adhere to the principles of the TTM and can be perceived as coercive, undermining the therapeutic relationship and potentially leading to client disengagement. Another incorrect approach might be to solely focus on knowledge dissemination without considering the client's motivation or self-efficacy, neglecting key components of social cognitive theory and the TTM, and failing to address the behavioral and environmental factors that influence food choices. Professionals should employ a decision-making process that begins with a thorough assessment of the client's current behavior, attitudes, and readiness for change. This involves active listening, empathetic questioning, and potentially using validated assessment tools. Based on this assessment, the professional can then select appropriate theoretical frameworks, such as the TTM or social cognitive theory, to guide the intervention. The intervention should be collaborative, empowering the client to set realistic goals and develop strategies that build upon their existing strengths and address their perceived barriers. Regular reassessment and adjustment of the intervention plan are also critical components of effective and ethical practice. Question 15. Process analysis reveals that a client is seeking to increase muscle mass and improve overall recovery after strenuous exercise. They have a general understanding that protein is important, but are unsure about the nuances of different protein sources and their impact on the body's ability to build and repair tissues. As a certified in family and consumer sciences, CFCS, professional with a nutrition focus, how should you best advise this client regarding protein intake, considering the roles of amino acids in protein synthesis? Option A. Recommend a broad-spectrum amino acid supplement to ensure they are getting all necessary building blocks, as dietary sources can be unreliable for meeting specific amino acid needs for muscle growth. Option B. Advise the client to simply increase their overall daily protein intake to a high level, as more protein will directly translate to greater muscle synthesis, regardless of the specific types of amino acids consumed. Option C. Explain that protein synthesis relies on a balance of essential amino acids, which must be obtained from the diet, and guide the client in identifying dietary sources that provide a complete profile of these amino acids, such as animal products and certain plant-based combinations, to support their goals. Option D. Focus on the non-essential amino acids, explaining that the body can synthesize these, and therefore, they are the primary focus for dietary intake to support protein synthesis. The correct answer is C. Explain that protein synthesis relies on a balance of essential amino acids, which must be obtained from the diet, and guide the client in identifying dietary sources that provide a complete profile of these amino acids, such as animal products and certain plant-based combinations, to support their goals. Explanation. This scenario presents a common challenge for nutrition professionals, translating complex biochemical concepts into practical, actionable advice for diverse client populations. The professional challenge lies in accurately assessing dietary intake, understanding individual nutritional needs, and providing guidance that is both scientifically sound and culturally appropriate, all while adhering to professional standards and ethical guidelines. The CFCS certification emphasizes practical application of knowledge, making the ability to differentiate between essential and non-essential amino acids and their dietary sources crucial for effective client counseling. The correct approach involves a thorough understanding of protein metabolism, specifically the roles of essential and non-essential amino acids, and how to identify complete and incomplete protein sources. This allows for the creation of a personalized dietary plan that ensures adequate intake of all essential amino acids, supporting protein synthesis for optimal health. This aligns with the CFCS focus on evidence-based nutrition guidance and the ethical responsibility to provide accurate and beneficial information to clients. An incorrect approach would be to oversimplify the concept of protein, focusing solely on total protein quantity, without considering amino acid profiles. This could lead to recommendations that, while meeting a general protein target, might not provide the full spectrum of essential amino acids, potentially impacting protein synthesis and overall health outcomes. This failure to consider the qualitative aspects of protein intake represents a deficiency in professional knowledge application and could be considered a breach of ethical duty to provide comprehensive advice. Another incorrect approach might involve recommending specific supplements without a thorough assessment of dietary intake and individual need, which could be unnecessary, costly, and potentially harmful, violating the principle of providing evidence-based and client-centered care. Professional decision-making in such situations requires a systematic process. First, a comprehensive client assessment including dietary history, health status, and lifestyle. Second, application of scientific knowledge regarding nutrient requirements and metabolism. Third, development of a personalized, evidence-based nutrition plan. And finally, ongoing monitoring and evaluation of the plan's effectiveness and client adherence. This iterative process ensures that advice is tailored, safe, and effective. Question 16. Examination of the data shows that a new processed food product contains a significantly higher level of a specific added sugar compared to similar products on the market, and preliminary research suggests a potential link between high intake of this sugar and increased risk of a particular chronic disease. A family and consumer sciences professional is tasked with advising consumers about this product. Which of the following approaches best aligns with U.S. regulatory frameworks and ethical professional practice for communicating this information? Option A. Suggests that consumers consult the product's marketing materials for information on its nutritional profile, as the manufacturer has likely highlighted any beneficial aspects. Option B. Focus on the product's convenience and taste, downplaying the significance of the added sugar content and the preliminary research findings to avoid unnecessary consumer alarm. Option C. Advise consumers that the product should be avoided due to the potential health risks associated with the high level of the specific added sugar, citing the preliminary research and emphasizing the importance of limiting intake of such sugars based on established dietary guidelines. Option D. Recommend the product to consumers seeking to increase their intake of this specific added sugar, as it is a readily available source, and the preliminary research is not yet conclusive enough to warrant concern. The correct answer is C. Advise consumers that the product should be avoided due to the potential health risks associated with the high level of the specific added sugar, citing the preliminary research and emphasizing the importance of limiting intake of such sugars based on established dietary guidelines. Explanation: this scenario is professionally challenging because it requires a family and consumer sciences professional to interpret complex food composition data and its implications for public health messaging, specifically within the context of U.S. federal regulations governing nutrition labeling and claims. The challenge lies in accurately translating scientific data into actionable, compliant, and ethically sound advice for consumers. The correct approach represents best professional practice because it prioritizes adherence to the U.S. Food and Drug Administration, FDA regulations for nutrition labeling, and the Federal Trade Commission, FTC, guidelines for advertising and marketing. This ensures that any information disseminated about food composition and nutrient analysis is accurate, not misleading, and supports informed consumer choices without making unsubstantiated health claims. Professionals must rely on established scientific methodologies and regulatory standards to avoid misrepresenting nutritional information, which could have serious public health consequences and lead to regulatory action. An incorrect approach that focuses solely on novel or emerging research without considering established regulatory frameworks is professionally unacceptable. This is because it risks disseminating information that has not been validated by regulatory bodies or may be presented in a way that violates advertising standards, potentially leading to consumer confusion or harm. Such an approach fails to meet the ethical obligation to provide reliable and compliant information. Another incorrect approach that emphasizes anecdotal evidence or personal interpretation over scientifically validated data and regulatory guidance is also professionally unacceptable. This violates the principle of evidence-based practice and can lead to the spread of misinformation. It disregards the rigorous scientific review and regulatory oversight designed to protect consumers. A third incorrect approach that prioritizes marketing or promotional aspects over factual accuracy and regulatory compliance is ethically and legally flawed. This can result in misleading claims about a food product's nutritional benefits, potentially deceiving consumers and violating consumer protection laws. The professional decision-making process for similar situations should involve a systematic evaluation of the data against current U.S. federal regulations, FDA, FTC. This includes identifying the specific nutrients of concern, understanding their established roles in health, and determining if any claims or interpretations can be made that are supported by scientific evidence and permitted by regulatory bodies. Professionals must always err on the side of caution, ensuring transparency and accuracy in all communications related to food composition and nutrient analysis. Question 17. Performance analysis shows that a certified in family and consumer sciences professional is advising a client on adopting healthier eating habits. The professional needs to translate the principles of the dietary guidelines for Americans into practical, actionable advice. Which of the following approaches best reflects an understanding and application of these guidelines within the U.S. regulatory framework? Option A. Recommending a strict elimination of all processed foods, regardless of their nutritional profile or the client's ability to maintain such a restriction long-term. Option B. Emphasizing the importance of a varied dietary pattern rich in nutrient-dense foods, while also guiding the client on how to limit added sugars, saturated fats, and sodium, and encouraging personalization based on individual needs and preferences. Option C. Focusing exclusively on reducing carbohydrate intake, as this is a primary driver of weight gain according to some popular diet trends. Option D. Providing a generic meal plan that strictly adheres to the minimum recommended daily intake for all macronutrients, without considering the client's specific lifestyle or activity level. The correct answer is B. Emphasizing the importance of a varied dietary pattern rich in nutrient-dense foods, while also guiding the client on how to limit added sugars, saturated fats, and sodium, and encouraging personalization based on individual needs and preferences. Explanation. This scenario is professionally challenging because it requires a family and consumer sciences professional to interpret and apply complex, evolving dietary recommendations to diverse client needs, ensuring accuracy and ethical practice within the specific regulatory framework of the United States. The Dietary Guidelines for Americans, DGA, are evidence-based recommendations that are updated every 5 years, necessitating continuous professional development and a nuanced understanding of their application beyond simple memorization. The professional must navigate potential conflicts between general guidelines and individual circumstances, while adhering to ethical principles of client-centered care and evidence-based practice. The correct approach represents best professional practice because it prioritizes a comprehensive understanding of the DGA's core principles and their adaptability to individual dietary patterns. This involves recognizing that the guidelines are not rigid rules, but rather a framework for healthy eating that can be tailored to specific needs, preferences, and cultural backgrounds. By focusing on the overarching themes of nutrient-dense foods, limiting added sugars, saturated fats, and sodium, and promoting variety, the professional can effectively guide clients toward healthier choices that align with the DGA's intent. This approach is ethically sound, as it empowers clients with knowledge and skills for sustainable dietary changes, respecting their autonomy and promoting well-being. It is also compliant with the DGA's emphasis on personalized nutrition within a public health framework. An incorrect approach that focuses solely on a single nutrient or food group without considering the broader dietary pattern fails to adhere to the holistic nature of the DGA. This is a regulatory failure because the DGA emphasizes overall dietary patterns, not isolated components. Ethically, it can lead to an unbalanced and potentially harmful dietary recommendation, neglecting other crucial aspects of nutrition. Another incorrect approach that rigidly applies a one-size-fits-all interpretation of the DGA, disregarding individual client factors like age, health status, or cultural practices, is also professionally unacceptable. This represents a failure to meet the DGA's implicit goal of promoting health for all Americans, as it overlooks the diversity of the population. Ethically, it can alienate clients and lead to non-adherence, undermining the professional's role as a trusted advisor. A third incorrect approach that relies on outdated or unverified information about the DGA rather than consulting the most current official publications is a significant regulatory and ethical failure. This demonstrates a lack of due diligence and a disregard for the evidence-based foundation of the guidelines, potentially leading to the dissemination of inaccurate and harmful nutritional advice. The professional decision-making process for similar situation should involve a systematic approach. First, thoroughly understanding the most current iteration of the dietary guidelines for Americans, including its scientific basis and key recommendations. Second, assessing the individual client's needs, health status, cultural background, and personal preferences. Third, synthesizing the DGA with client-specific information to develop personalized, evidence-based recommendations. Fourth, communicating these recommendations clearly and effectively, empowering the client to make informed choices. Finally, ongoing professional development to stay abreast of updates to the DGA and other relevant nutritional science is crucial. Question 18. The risk matrix shows a novel food processing technology that claims to significantly enhance the bioavailability of essential micronutrients in fortified cereals. However, preliminary internal research indicates potential for minor, uncharacterized chemical byproducts to form under specific processing conditions. As a CFCS professional with a nutrition focus, which approach best aligns with regulatory requirements and ethical best practices for evaluating this technology? Option A. Recommend immediate adoption of the technology based on the significant reported nutritional benefits and the minor nature of the uncharacterized byproducts, assuming they pose no immediate health threat. Option B. Rely on the marketing materials and testimonials from the technology provider, as they highlight the positive nutritional outcomes and suggest the byproducts are inconsequential. Option C. Advise against the technology's use solely due to the presence of uncharacterized byproducts, without further investigation into their potential impact or the benefits of the technology. Option D. Conduct a comprehensive literature review on similar processing technologies and their known safety profiles, consult relevant FDA guidelines on novel food processing, and initiate targeted laboratory studies to identify and quantify the byproducts and assess their toxicological implications before making any recommendation. The correct answer is A. Recommend immediate adoption of the technology based on the significant reported nutritional benefits and the minor nature of the uncharacterized byproducts, assuming they pose no immediate health threat. Explanation. This scenario is professionally challenging because it requires a certified in family and consumer sciences (CFCS) professional with a nutrition focus to evaluate the application of a novel food processing technology. The challenge lies in balancing the potential benefits of the technology, e.g., improved nutrient retention, extended shelf life, against potential risks, e.g., unintended chemical changes, allergenicity, consumer perception. A thorough understanding of food science principles, regulatory guidelines, and ethical considerations is paramount. The correct approach represents best professional practice because it prioritizes a comprehensive, evidence-based evaluation of the technology's safety and efficacy. This involves consulting established scientific literature, understanding the specific regulatory framework governing food additives and processing aids in the United States, as implied by the CFCS certification context, which is U.S.-based, and engaging with relevant regulatory bodies if necessary. This approach ensures that any recommendations made are grounded in scientific validity and adhere to consumer protection laws, such as those enforced by the Food and Drug Administration, FDA. It demonstrates a commitment to public health and informed decision-making, aligning with the ethical standards expected of a CFCS professional. An incorrect approach that relies solely on anecdotal evidence or marketing claims would be professionally unacceptable. This fails to meet the standard of due diligence required by regulatory bodies and could lead to the adoption of unsafe or ineffective technologies. It also violates ethical obligations to provide accurate and evidence-based information to consumers and stakeholders. Another incorrect approach that focuses only on cost-effectiveness without a thorough safety assessment is also a significant regulatory and ethical failure. Prioritizing financial gain over consumer safety is a direct contravention of food safety regulations and ethical principles. Furthermore, an approach that dismisses potential risks without adequate investigation, perhaps due to a lack of technical expertise or a desire to expedite adoption, poses a serious risk to public health and could result in legal repercussions for the professional and the organization. The professional decision-making process for similar situations should involve a systematic risk assessment. This includes identifying potential hazards, evaluating their likelihood and severity, and determining appropriate control measures. Professionals should consult relevant scientific databases, regulatory guidance documents, e.g., FDA guidelines on food processing technologies, and expert opinions. When faced with novel technologies, a precautionary principle should be applied, ensuring that potential risks are thoroughly investigated before widespread adoption. Transparency and clear communication of findings, supported by robust data, are also crucial. Question 19. Analysis of how a certified in family and consumer sciences, CFCS, professional operating within the United States regulatory framework should best advise a client on daily water intake, considering the importance of hydration, various sources of water, and established recommendations. Option A. Advise the client to consume at least 8 glasses of water per day, as this is a widely recognized and simple guideline for adequate hydration. Option B. Recommend a specific quantity of filtered tap water daily, emphasizing its purity and cost-effectiveness as the primary source for optimal hydration. Option C. Provide a general daily water intake recommendation based on the U.S. National Academies of Sciences, Engineering, and Medicine's adequate intake AI guidelines, while also advising the client to consider individual factors such as activity level and climate. Option D suggests that the client's hydration needs can be met primarily through caffeinated beverages and sugary drinks, as these also contribute to fluid intake. The correct answer is C. Provide a general daily water intake recommendation based on the U.S. National Academies of Sciences, Engineering, and Medicine's adequate intake AI guidelines, while also advising the client to consider individual factors such as activity level and climate. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a family and consumer sciences professional to provide accurate and evidence-based guidance on water intake to a diverse population, considering varying individual needs and potential health implications. Misinformation or inappropriate recommendations can lead to dehydration or overhydration, impacting overall health and well-being. The professional must navigate the balance between general recommendations and personalized advice, ensuring adherence to established nutritional guidelines. Correct approach analysis. The correct approach represents best professional practice because it aligns with the principles of evidence-based nutrition and the regulatory framework governing nutrition advice within the United States. Specifically, it emphasizes consulting established dietary guidelines, such as those from the U.S. National Academies of Sciences, Engineering, and Medicine, NASEM, which provide authoritative recommendations for adequate intake AI of water. This approach prioritizes accuracy, safety, and public health by grounding recommendations in scientific consensus and regulatory standards. It also acknowledges the need for individual assessment, a cornerstone of ethical and effective nutrition counseling. Incorrect approaches analysis. One incorrect approach fails by relying on anecdotal evidence or popular trends rather than scientifically validated sources. This violates the ethical obligation to provide accurate and evidence-based information and could lead to harmful recommendations. It disregards the regulatory expectation that nutrition professionals operate within established scientific and public health frameworks. Another incorrect approach errs by providing a single, rigid recommendation without considering individual factors like activity level, climate, or health status. This is problematic because general recommendations are starting points, and individual needs for water can vary significantly. Such an approach lacks the nuance required for effective nutrition guidance and could be detrimental to individuals with specific physiological requirements, potentially leading to adverse health outcomes. It also fails to meet the professional standard of personalized care. A third incorrect approach is problematic by recommending specific bottled water brands or types without a clear health-related justification. This could be perceived as a conflict of interest or an endorsement that is not scientifically supported by general hydration guidelines. It deviates from the focus on essential nutrient intake and may mislead consumers about the necessity of specific commercial products for hydration. Professional reasoning. Professionals should approach water intake recommendations by first understanding the established dietary guidelines for water intake in the U.S. This involves familiarizing oneself with the NASEM recommendations for adequate intake AI for different age groups and genders. Subsequently, the professional must assess individual factors that influence hydration needs, such as physical activity, environmental conditions, and health status. The decision-making process involves synthesizing general guidelines with individual assessment to provide personalized, safe, and effective recommendations. This iterative process ensures that advice is both scientifically sound and practically applicable, adhering to ethical standards and regulatory expectations for nutrition professionals. Question 20. The control framework reveals that a client seeking guidance on a gluten-free diet for celiac disease also expresses interest in adopting a vegan lifestyle. Which of the following approaches best aligns with professional standards for providing nutrition advice in this context? Option A. Recommend a broad range of vitamin and mineral supplements without a specific assessment of the client's nutritional status, stating that these are generally beneficial for individuals following restrictive diets. Option B. Provide a comprehensive meal plan that ensures adequate intake of all essential nutrients, specifically addressing potential deficiencies common in vegan diets, e.g., B12, iron, calcium, vitamin D, omega-3 fatty acids, and strictly adhering to gluten-free principles, while also recommending evidence-based strategies for managing celiac disease through diet. Option C. Advise the client that combining a vegan and gluten-free diet is overly restrictive and likely to lead to significant nutrient deficiencies, suggesting they prioritize one dietary change at a time. Option D. Offer general advice on healthy eating, emphasizing the importance of fruits and vegetables, without delving into the specific challenges or nutrient considerations of a vegan and gluten-free diet. Correct answer is B. Provide a comprehensive meal plan that ensures adequate intake of all essential nutrients, specifically addressing potential deficiencies common in vegan diets, e.g., B12, iron, calcium, vitamin D, omega-3 fatty acids, and strictly adhering to gluten-free principles, while also recommending evidence-based strategies for managing celiac disease through diet. Explanation. This scenario is professionally challenging because it requires a nutrition professional to navigate the complexities of providing accurate and safe dietary advice to individuals with specific dietary needs, while adhering to established professional standards and potentially regulatory guidelines for consumer advice. The challenge lies in ensuring that the advice given is not only nutritionally sound, but also respects the individual's chosen dietary pattern and avoids making unsubstantiated health claims. The correct approach represents best professional practice because it prioritizes evidence-based information and client-centered care. By consulting reputable, peer-reviewed sources and professional organizations, the nutrition professional ensures the accuracy and safety of the advice provided. This aligns with ethical principles of competence and beneficence, ensuring the client receives reliable guidance. Furthermore, it respects the client's autonomy by acknowledging and working within their chosen dietary framework, such as vegetarianism or veganism, without judgment. This approach also implicitly adheres to any relevant consumer protection guidelines that prohibit misleading or unsubstantiated health claims. An incorrect approach that involves recommending specific supplements without a clear nutritional deficiency, identified through assessment, or without consulting established guidelines for those dietary patterns is professionally unacceptable. This could lead to unnecessary expense for the client, potential adverse interactions, or even mask underlying health issues. Ethically, it breaches the principle of non-maleficence by potentially causing harm. It also fails to demonstrate professional competence if the recommendation is not grounded in current scientific understanding or professional consensus. Another incorrect approach, such as dismissing the client's dietary choices as unhealthy or nutritionally inadequate without a thorough assessment and evidence-based rationale, is ethically problematic. It demonstrates a lack of respect for client autonomy and can damage the professional relationship. It also fails to meet the standard of providing objective, evidence-based advice. A third incorrect approach, which involves providing generic advice that does not specifically address the nuances of vegetarian, vegan, or gluten-free diets, is also professionally deficient. While not overtly harmful, it fails to meet the client's specific needs and demonstrates a lack of specialized knowledge or application, thus not representing best practice in providing tailored nutritional guidance. The professional decision-making process for similar situations should involve a systematic approach. First, thoroughly understanding the client's dietary pattern and reasons for it. Second, conducting a comprehensive nutritional assessment. Third, consulting current evidence-based resources and professional guidelines relevant to the specific dietary considerations. Fourth, developing a personalized, safe, and effective nutrition plan. And finally, educating the client and monitoring their progress, always maintaining ethical conduct and respecting client autonomy.